Close. What is this? From where did this come? Oops. Hi. Dr. Garima here, and we'll be discussing another one of Australian dental written part exam scenario based question, not multiple choice question. Okay, scenario based questions are based on scenarios. They are, of course, dental questions and they check your clinical skills. But before I proceed, I just want to share something which is making me feel so sad at the moment. As in, you'll know what I'm saying about you, probably will laugh over it, but all the young mothers out there will feel my pain. So, my son is like 2.5, and I've put him in summer camp. So, normally in the morning when he has to go, sometimes he's like, I don't want to go today, mommy, papa, I don't want to go, stuff like that. So since past 3 days in his summer camp, a girl has enrolled and she's also as old as him, 2.5. Her name is Ishika. And whenever he comes home, I ask him, how was your day and what did you play? So when this girl had joined, he came and he said, I have a new friend. And I was like, what's the name of your friend? And he's like, Ishika. And he blushed. I'm like, okay, fair enough. He's got a girl in his class, and they both are playing together. Fair enough. Next day, I thought the same drill will go. I'm trying to get him ready and dress up, and this time he's cooperating very nicely, and I'm like surprised. How is he cooperating so nicely? So then I'm like, wow. So you know where we are going, right? He's like, yes, Raffles. His nursery name is Raffles. So I'm like, yes, we are going to Raffles. So he's like, yeah, mommy, let's go to Raffles. So I'm like, you are ready to go to Raffles? You don't want to stay home? Like, no, no, no. Where are my shoes? Let me wear them. So I was like, you will leave mommy and go to Raffles by yourself? So he's like, yes. And very confidently he said that. And I was like, but mommy will miss you. So he's like, yes, but Ishika is there, so I will play. And he just said, Mama, let's go. And he went to Ruffles. He said me bye bye and he left. I mean, he's 2.5, right? He's just a small baby. And he already has gone to his friends, leaving Mama alone at home. I mean, a little bit of struggle, I understand. He's like, Mama, I don't want to go, and I'm leaving him. I'm like, I'll be coming. Nothing. He's all grown up. So, anyways, yeah, I think this day had to come and it came today, but I wasn't expecting it so early on in life. I don't see that day far away where he'll be like, okay, I'm going to stay somewhere else, with my girlfriend, etc., whatever. Anyways, yeah, let's go back to our questions. That's what we have at the moment. I hope your exam preparations are going fine and you are nervous and jittery and having butterflies in your stomach. If you don't, that means you're not preparing well. No, no, no. You should be confident and good things will happen, definitely. Let's start. A 30-year-old man complains about the color of one of his anterior teeth. The tooth had a treatment done 15 years ago. 15 years ago. 15 years ago, I was in Bombay after a sports accident and had a lot of treatment done to the tooth, but he does not remember which tooth it was. So apparently, he had on both the front teeth something is done and he doesn't remember which tooth it was. But of course, you can see. Now, what is his chief complaint? He's complaining about the color. There is no complaint of pain, spontaneous pain, biting pain, or any other swelling or any other. He's just bothered about the color. And when you see such a tooth, you know for sure that the tooth is dead. Either calcification has happened or the pulp has necrosed, but definitely it's not a healthy vital tooth. So, and it's been a long time. So, let's see what are the questions. Which test would give you the maximum information that will help you to do the treatment planning for this tooth? Again, the adjective here is maximum, because whenever I have explained 100 and 1,000 times in all of my videos that whenever an adjective is added like initial, best, first, maximum, all these things, it means all the given options would be correct. So basically, all the tests given in the options would be correct. But if I have to choose one which would give me the maximum information, which one would that be? Since I've already seen this tooth clinically and I know it's pretty much dead, doing a sensitivity test is not going to be of much use to me. But if I have to do any treatment, I need to see the surrounding area and the periapical status, and hence the periapical X-ray would give me the best information. I would not go for OPG because for the anterior teeth, the spine superimposes. So my periapical X-ray would be the best thing. But if I had any other tooth, for example, a molar or something, then probably I would have thought about OPG. Thought, not like chosen the answer. I would have seen the scenario a bit more better. Like more details should have been given for me to choose the OPG as the first line of X-ray rather than periapical. But for this particular tooth, for sure, periapical X-ray. Percussion is correct, OPG is correct, driller cavity, pulse sensitivity are all correct form of test. But the most uh, comprehensive information that I will get is from the periapical X-ray. And drilling a cavity is like an invasive test. You should always keep that as the last form of test because once you invade the tooth, there is no reversing back. if if this tooth had no previous endodontic treatment, it's a hypothetical imagination thing. Like for example, the scenario did mention that the tooth had, but for example, if this tooth had no previous endodontic treatment, then what would be the cause of the labial surface discoloration? We know for sure that when there is necrosis of pulp or the one pulp dies, the remnants, it's a connected tissue after all, the remnants decompose and they disintegrate. Sorry. And then see, in a normal skin, if somebody hits you, the blood clot will form. After some days, you'll see a bluish blackish discoloration over that area, and then slowly and steadily the blood supply in that area will remove those formed disintegrated formed components, and the skin will come to a normal color. But in the tooth, it's surrounded by hard tissues, that is dentinal tubules are there, and enamel is there. Now they of course don't have any blood supply. The only blood supply that was coming from was from the pulp, but the pulp is dead, and so it's its blood supply. So whatever the blood remnants remain, they will eventually decompose and the materials are going to leak inside the dentinal tubules, and eventually it's just going to get clotted, and that color is going to be visible from outside. So definitely the cause of labial discoloration for this particular tooth is pulp necrosis. Discoloration of restoration and tetracycline stains. Well, if there were tetracycline stains, then they should be there on the other teeth as well. It cannot happen that only one tooth is affected by tetracyclines. And restoration discoloration is a good option, but here neither the scenario mentioned, neither the tooth shows any form of restoration over it, which should look like this. So, and since we have a history of trauma, definitely the answer is pulp necrosis. Now, after radiographical examination, it was seen that the tooth has satisfactory endodontic treatment. Great. Now, what could be the most likely cause of discoloration? So, this tooth, for example, on the X-ray showed that proper obturation is done. Then why is it discolored? This is assuming, for example, the tooth suppose didn't have trauma and there was example just a small caries from somewhere which had damaged the pulp, and suppose such a tooth gets discolored, then what is the first most important cause? uh, any discoloration in an endodontic tooth, the major cause is often a lot of sealer which is left inside the pulp chamber. If that is not given in your option, then the second best is that you have not removed the pulpal remnants from the pulpal horns and you have not cleaned the pulpal cavity properly. See what happens, especially in the anterior teeth. If you know the pulp chamber is here, if you see my arrow, But when we access it, unlike the molars, you access it from the cervical area a little bit in the middle of the tooth, but from the lingual portion. And when you access it, you directly put your file inside. So sometimes this area, which where the horns of the pulpal coronal part of the pulp is there, if you don't excavate it properly with your spoon excavator, some remnants can be left. And if they are left, then again a discoloration is going to happen. So let's see what options are available for us here. Incomplete debridement of pulpal chamber, good option. Insufficient coronal seal, no. Over obturation, probably. Under obturation, no. But in over obturation, if you think it's obturated more coronally, it's rare, but over obturation usually means you have gone beyond the apex. Going beyond the apex has got nothing to do with my crown of the tooth. So I'm not going to go with over obturation actually. Coronal filling material color. To a certain extent, yes, but coronal filling material, they have not mentioned what. If they would have mentioned that extra sealer left in the coronal portion, then that should have been my first choice. But coronal filling material color, it can be anything, and they have not mentioned which material. So I'm not going to go with that option. Since I have a better option already, option A, incomplete debridement of pulpal chamber, which indeed is one of the most important causes of the discoloration, I'm going to go with that. But if the option of excess seal left in the chamber was there, I would have chosen that over the incomplete debridement of pulpal chamber. So remember this in the sequence. In the feedback for this question, I have given that if you are an enrolled candidate and you're solving this mock, you'll get a good feedback once you have solved this question, in which I have mentioned the sequence. What is the best treatment step for him? Okay. So his chief complaint was the color, and we want to change the color. Now, again, which is the best treatment? Sorry, I moved my cursor accidentally, and so now you can see the answer, but it's okay. We'll reach the logical wise. Best, best first treatment step. Best. This best is the adjective. First is an adjective here of the question. That means all the treatment options given would be correct. But which would be my first step? External bleach. External bleach is not going to help me that much because the discoloration is from within the tooth. So externally is not going to help me. Internal bleaching, yes, because the discoloration is from within, and I would like to clear the dentinal tubules of the what do you say, deposited remnants of the blood coagulant stuff. Fabricate PFM crown. That's an invasive method, and if my internal and external bleaching don't work, then I will go for the crown and composite veneer. Veneer again, it's not a bad option, but still you'll have to drill the tooth a little bit. So whenever you choose an option and the question mentions best options, you should always opt for something which is conservative, because once you drill a tooth, it's irreparable damage. So unless you don't have any other option but to drill the tooth, then only you should go with that. So internal bleaching is the right option of choice because the tooth has a sufficient acceptable endodontic treatment which is done. And internal bleaching is done in endodontically treated tooth, and especially to lighten its color from within and remove all those oxidized things which have happened. So internal bleaching is the right choice, which is also called as a walking bleach technique. Read more about it. Pause this video, read more on walking bleach technique. If you decide to do internal bleaching, what could be the risk? Internal resorption, external cervical resorption, apical periodontitis, carious lesion, and tooth cracking. Tooth cracking, no. Carious lesion, no. Apical periodontitis, no, because the obturation has been done properly. Now, if you are stuck, you'll be stuck between A and B. Internal resorption will happen if the root is empty, but the root is properly filled. So that is not going to happen. External cervical resorption is the right choice because what happens here is You're putting basically the material inside the pulpal chamber, and there are dental tubules which are connected to it, especially in the cervical area, and the material can leach out through that because it's a hollow area, the dental tubules basically. So when it leaches out, it can result in external cervical resorption. Hence, that is the option of choice. So you can inform the patient that there is a possibility, but it's rare. But you have to inform them of the possibility because you're using very caustic materials, which are going to cause the hydrogen peroxide, which would be used, sodium perborate, and that are going to release some caustic chemicals, and that's how they're going to bleach the tooth from inside. So it may result in external cervical resorption. So I hope this is clear now. Pretty easy question actually. I like such questions which have straight one set of answer. Easy to diagnose. But yeah, again very easy to make mistakes as well because all of the sub questions had which is the best test which you would do, which is your investigation, which will give you the maximum diagnostic value, the best treatment of choice. So this adjectives are confusing, but if you're focused on what exactly the question is asking you, and you know the sequence in which you are supposed to proceed, then it's a very easy question. So I hope this is clear. And if you have any more doubts, leave me in the comment section. I try my best to shoot a video a day, but sometimes either I'm exhausted or just overloaded with other work that I'm unable to shoot a video, or I'm just busy with something else. So, but I do solve the doubts of all my candidates. Wow, we have grown, you know. Like, I remember when we had started the enrolled candidates group, it was nice. And then, as and when the candidates passed the exam, I asked them to leave the group. So, almost 30 candidates have left, and still we have like 163 members. So it's nice. I mean, of course, you people keep me busy. Actually, what I'm saying, I'm busy with other stuff. I get almost 30 to 40 messages from the enrolled candidates. I've made them a WhatsApp group. They also discuss among themselves and solve the query. But I prefer them asking directly to me because see, each candidate has its own weakness. You know, this is not a dental school that I'm teaching you something. You may be strong in some subject and weak in some subject. So I analyze when you ask me a question. I try to reverse ask you as to what is your doubt so that you understand the question better and you start thinking in a specific way because all of you are thinking in a different way. So I like my mentoring to be one on one, specific to what is to your need rather than just giving you a template, follow this. That is not going to work, you know. If a certain template was working for everyone, then everybody would clear the exam. But that is not the scenario. So everybody has his own strengths and weaknesses. To some of the candidates, I tell them go read more textbooks because I feel that their basics are lacking. To some of the candidates, I say focus on the keyword and so on and so forth. To some of them, I keep on asking them questions. Why do you think like that? Go open your textbook, send me a screenshot, and then they only realize, okay, what mistake they have made, you know. It's not like I'm going to spoon feed you the answers. I want to understand uh, where you're making a mistake, and then I make you understand where you're making a mistake. You understand? So, yeah, almost 1.5 hours go in a day to answer the doubts, and I'm more than happy to do that. So, yeah, that's how it's going. I hope I shoot another video tomorrow. So, have a nice day, guys. Bye bye.